Ligaments are basically the sensory organ of the joint. This is one of the most important concepts for people with chronic pain to understand. Like exactly what tells the brain that the joint's having a problem. Whether the joint's having a problem during a workout, like you're doing a workout, right? You're doing speed work on the track, you're lifting weights, you're doing a workout. What exactly tells the body that you better stop doing that or something's going to happen to your joint? Like what exactly tells the brain that that's a problem? Well, it's actually the ligaments. The ligaments are the sensory organ of the joint. And to illustrate this point, I'm going to ask my nephew Kyle, who's going to the University of Iowa, to do an arm bar on me. So he'll do an arm bar on me. So with the arm bar, I'm starting to feel significant pain around my elbow. And this is a common wrestling move that's used in mixed martial arts to get people to submit. Like in other words, the ligament in my elbow and my shoulder, thank you, Kyle, was starting to get stretched out. And if he continued it and I didn't submit, like I didn't tap out, that's what they call tap out, and tell him to stop it, like in other words, then I would lose the match if we were in a mixed martial art match. If I didn't tap out, basically my elbow or my shoulder would dislocate. So in other words, think about how sensitive the ligaments are that mixed martial artists, which are probably maybe the toughest guys on the planet, like if that ligament starts stretching a lot, a mixed martial artist, world champions will tap out because otherwise the whole thing's going to dislocate. So when you're in a workout or you have chronic pain and it's really, really sharp, realize the ligaments are the sensory organ. Ligaments have lots of different nerve endings in them. They have free nerve endings, they have Golgi organs in them, and other nerve endings that send a signal to the brain like, hey, this joint is getting unstable, right? Kyle, when he was putting that pressure on me, he was starting to stretch the ligament and the joint was starting to become unstable. And the body doesn't want an unstable joint. So if you keep doing that workout or you don't get prolotherapy and get that joint stabilized, then all that's going to happen is the ligament injury is going to be further. It's going to be further. There's going to be increased pressures in the joint. You're going to get arthritis in the joint. So just know that why the joint has pain is basically because there's ligament injury. Ligaments are the sensory organ of the joint. And if you get prolotherapy, get the ligaments tightened, they get their strength back. The pain goes away, the instability goes away, and then you just get back to your workouts and you get back to everything. So prolotherapy, a great treatment for ligament injury, but it really stems from people really understanding that the ligaments are the sensory organ for the joint.